Important new series, Prescription for Change, Fixing American Healthcare. Today, we focus on how to improve the quality of care. In a growing trend, doctors are resorting to a bit of skullduggery, using undercover spies to evaluate their own performance. ABC's Heather Nauert spoke to the spies about what they found. Heather?
Good morning, Chris. Well, doctors are realizing that healthcare is a business. Keeping the patient happy is a way to ensure repeat business. And to learn more about this growing trend, we followed one of these spies along on one of her appointments.
Mona Sabat may seem like a regular patient shopping for a top-notch doctor, but she's actually a healthcare spy, hired by a doctor's office to evaluate their practice.
You want to see how clean the office is, if people acknowledge you when you walk through the door, if they remember your name, if the office is nice and they seem confident.
Mona works for a mystery patient service in San Diego, started by Jody Manfredi, a former healthcare sales rep.
We are allowing them to see their practice through the patient's eyes. We are their eyes and ears.
A growing number of doctors and other healthcare professionals are hiring mystery shopping firms to improve their business. Jody says that too often doctors focus only on successful medical outcomes, not patient satisfaction.
When a patient is happy when they leave that practice, they feel like they were treated with kindness and professionalism and respect, they're going to refer other patients to that practice.
We followed Mona to an appointment with a chiropractor at Pain Care of San Diego. She brought along a hidden camera.
Hi. How are you? Good, how are you? Good. I'm Mona Sabat.
Okay, go ahead and sign in for me.
Okay. I asked if there was a consultation fee. And at first she said yes, and then she said no, so I was a little confused.
Yeah.
Mona unexpectedly had to shell out $60 for the consultation. Then she measured how long she had to wait to be seen. 7 minutes.
Thank you.
Dr. Song.
Hi. Okay, great.
She assessed how well he answered her questions and how compassionate he was.
Whatever makes you feel comfortable.
Okay. I appreciate that. Thank you.
No
Nice
problem.
to
It was
meet
good to
you.
meet you. Come on.
After her appointment, she filled out the report. So how did they do?
There was a little confusion when I made the appointment. They were unclear on certain charges, and that was probably the biggest problem. It was not the doctor. I was very happy with the doctor.
But she made this observation.
I didn't see him wash his hands.
His response?
Actually, we wash our hands before we go see the patient. Yeah, so that's not a problem.
For Danny Song, maximizing the quality of care for his patients is also a matter of keeping a competitive edge.
They do have a choice on where they go, and so we need to make sure that we're doing what we can to make their experience a pleasant one and one that they enjoy.
Doctors say being spied on is a small price to pay to ensure happier patients and a successful practice.
Great. We spoke to other doctors who use these mystery shoppers and have applied their suggestions, and they say they're getting more repeat patients and more referrals. There's so many choices in healthcare providers these days, Chris, that the doctors realize they just have to stay competitive.
Yeah, and that's a good point. We're also joined now by ABC News medical editor Dr. Tim Johnson. This is interesting. It's good to know what kind of quality of care there is, but how much can a regular person really know about whether this doctor is the right doctor for you?
Yeah, that's the key thing. You want to make sure your doctor is making the right medical decisions for you, doing the right thing at the right time, avoiding medical errors, prescribing the right medications, etc. Very hard for an individual on their own to tell that. So I'd look for two things. Number one, is this doctor a part of a system that helps them monitor quality? If you're a part of a quality system like Kaiser Permanente or even the Veterans Administration Hospital, which has become a model, you can rely on them to pick good doctors in the first place, to monitor what they're doing, to find them if they're making mistakes. The second thing I'd look for is whether or not that office has become computerized, keeping electronic records. That's a pretty good sign they're up to date and modern. It's also a sign that they can go over their work, pick up mistakes from the computer data. So I'd say computers in the office being part of an integrated system are two good clues that that doctor's quality goes beyond human interaction to the knowledge base.
In your experience, is the nicest doctor always the best doctor?
No, I'll be honest and say. Now, you wish you had both, and that's the ideal, of course, but I will tell you in the past, I've seen some doctors who were so smooth and patients loved them, but I would have never gone to them myself because of what I knew about them, and vice versa. When I go in for surgery, I want to know what's behind the doctor's ears and in his hands. The human niceties I'll put aside for a good knowledge base in that situation.
And to finish, Doctor, where do you see this issue in fitting into the overall problem with health care? How big a deal is this?
It's a huge deal because I think one of the keys to controlling costs and improving quality is to develop these integrated health systems where doctors are monitors. We can't do it as individuals. We have to rely on the experts. And so that's a big part of healthcare reform.
Dr. Tim Johnson, thank you. Heather Nauer, thanks for bringing us the story. Our network-wide series, Prescription for Change, continues throughout the week. Later this evening, World News with Charles Gibson examines how one Salt Lake City doctor is radically improving quality. And on Nightline, a surgeon's crusade for improving end-of-life care. There's also full coverage 24 hours a day on abcnews.com, and you can see more on this in USA Today throughout the week. Robin?